think some people might be confused by the idea of using sauna in order to reduce the hot flashes. So I'll just remind people that your brain has a set of neurons in the medial preoptic area that's sort of a thermostat, if you will, controlling core body temperature. And if you heat the surface of your body, your medial preoptic neurons say, oh, let's cool down the core of the body. Now, if you stay in that heat too long, you'll cook. Your core body temperature will go up. But conversely, if the surface of your body is made cold, the internal milieu of your body will heat up because those medial preoptic neurons will say, oh, this is like putting an ice pack on the thermostat, which is what graduate students and postdocs used to do in the labs I'd work in, because it was a battle over the heater, right? Some people were in hot, some people were in cold. So there was always this business. In any event, so it's not that you disapprove of using deliberate cold exposure. You just recommend that women do deliberate cold exposure with temperatures that are maybe in the low 50 degree Fahrenheit range, as opposed to the really, frankly, just painfully cold for anybody, 38 to 50 degree temperatures. Is that right? Okay.
We did a pilot study looking, because Wim Hof has been down to New Zealand quite a bit. And so, his breathing and ice bath stuff has been making the rounds. And working in the high performance, people wanted to do that. But we have a few athletes that have really severe endometriosis. It's like, well, we could look at using cold exposure to help control that. And what we found over the course of this study was that if we were to do deliberate cold exposure around ovulation and then hold it for 10 days over the course of 3 menstrual cycles, it attenuated the endometriosis, because endometriosis is an inflammatory disease, right? So if we're looking at inflammation process and growing the tissue, if we can dampen that inflammation and create a response that learns that inflammation and dampens it, then it helps with endometriosis.
Very interesting.
That's another avenue that we really want to take when we're looking at deliberate cold exposure.
Wow, fascinating. As a cautionary note, if anyone is going to explore Wim Hof type methods, please, please, please do not combine cyclic hyperventilation or hyperventilation of any kind with breath holds and water exposure, not even in the depth of a puddle. There have been drownings associated with people doing cyclic hyperventilation in various contexts, not just related to Hof breathing, but basically people who are not skilled, and even some who are skilled, combining cyclic hyperventilation, breath holds, and water in any form, cold or warm water.
Bad idea.
Just don't. If you're going to do any kind of cyclic hyperventilation breathing, and my lab's actually published on this in a clinical trial, do it on dry land or don't do it at all. And if you're going to do deliberate cold exposure, limit your breathing to slow, deep breaths. Make sure that you're well supervised, and just stay alive, please.
Yeah.
So. Yeah.
We didn't incorporate any of the Wim Hof breathing. We just incorporated the deliberate cold water exposures.
Cold and temperature generally is such a potent stimulus. And it's exciting that people are starting to explore this, especially in my opinion, the sauna work. One thing I suppose that we should discuss very briefly before we move on, since we've been talking about resistance training, we've been talking about deliberate cold exposure. There is evidence that doing deliberate cold exposure, not so much in the form of a cold shower, but in the form of a submersion up to the neck, post-strength or resistance training, say in the 4, but probably the 8 hours after resistance training, because of the attenuation of the inflammatory response, which sounds like a great thing, it actually can inhibit some of the strength and hypertrophy gains that one would otherwise experience. So if you're going to do deliberate cold exposure, best to not do it in the 8 hours or even on the same day after resistance training geared towards developing strength and hypertrophy increases. No problem to do it first. In fact, maybe even some performance enhancing effects of doing it first. There's some athletes at Stanford doing that, but just want to throw that out there. Is there anything else you want to add to that?
Which is different from heat exposure, because heat exposure you want to do afterwards.
Get the vasodilation.
Yeah, because it extends that training stimulus. And also the passive dehydration from training will stimulate greater blood volume improvements.
Oh, interesting. So after a good weight training session, if one has the luxury of doing it, get into the sauna for
up to 30 minutes.
Make sure you're hydrating.
You want slow rehydration, because part of it is that dehydration and the decrease of oxygen at the level of the kidney to stimulate more EPO. So with more red cell production, you have natural increase in plasma volume. So it's a blood volume expander.
Ooh, so now we're getting into real performance enhancement. Is this true for men and for women?
Yep. Yeah.
Let's walk through this protocol.
Okay.
I like this. This has not been discussed on this podcast. So somebody does their resistance training, finishes up, drinks 8 or 16 ounces of water with a little salt in it maybe, and then hops in the sauna.
Yep.
For how long?
Up to 30 minutes.
Okay.
No
And
longer.
No longer.
No longer. Yeah.
They'll probably be a little bit thirsty in there. You're looking for a little low-level dehydration. Is that right?
Yep.
Okay. The ranges that I've seen published in the Finnish studies are, as I recall, and I'll double check these numbers, 186 degrees Fahrenheit up to about 210 Fahrenheit. And the higher end only being for those that are heat adapted.
Yeah.
One can cover their head with a towel and actually feel more comfortable because the brain is insulated. This surprises people. They think putting something on their head would make it excessively warm.
Yeah.
But you actually are protecting your brain from some of the heat.
And people will put a towel over so that when they breathe, it doesn't burn the inside of their nose and their mouth either. I'm always like, if you're going to be in and it's that hot, just move down a level. So
Down
then
on the floor.
Yep.
And this stimulates the production of more red blood cells. Okay. Which then translates to what in terms of athletic performance?
You have an increase in your cardiovascular effort. And because you have a greater amount of blood volumes, you have greater amount of pretty much blood circulating. So you have more available for muscle metabolism, heat loss. So it's akin to going to altitude. So people will go to altitude to get that blood volume boost, but not everyone responds to altitude because you have responders, non-responders, over-responders.
Okay. So this is why when I go to Colorado, I'm gasping for air while I do a walk, but then I come back to sea level and I feel better. My endurance is better, but some people might not experience that effect.
True. I was telling the guys before we started that I've been in our sauna at home in preparation for going to Park City because I live at a beach town, and going to Park City, I am a significant responder to altitude, and I won't be able to have coherent meetings at altitude if I am not adapted. So,
okay.
Yeah.
So this explains why when I've gone to meetings in Colorado at altitude, some people can have a drink that first night and they're perfectly fine, even though they normally live at sea level, and I'm trying to see the stairs correctly, even though I don't drink.
Yep. That would be it. Very
interesting. So you can use post-resistance training sauna exposure to improve performance.
Yeah. And you can use it post-cardio as well. So anything that is giving you that passive dehydration from training, because you will become passively dehydrated when you're training, right? You can't keep in as much fluid. So I'm saying passive as in you're not able to stop that dehydration. And then you go into the sauna and you are extending that training stimulus because your heart rate is elevated. You're putting your body under stress from dehydration, and the body responds in kind of, we need more blood volume. So let's jumpstart that.
I love it. Logically watertight, and I'm going to give it a try.
Yeah.
What other training tricks, tips do you have up your sleeve, Dr. Sims?
What you want to talk about?
Do you have any favorites besides that? I delight in these, and I know other people will as well. Do any come to mind? I mean, you've taught us about Shashandra, about post-training sauna exposure to improve performance by increasing red blood cell count. Is there anything else that kind of springs to mind? No pressure.
I'm a fan of what I call the track stack that we used to use for track athletes, but then for really significant high intensity work. So track stack is kind of the idea from the old bodybuilding set where you're taking 200 milligrams of caffeine, low dose baby aspirin, but then I add beta alanine.
Used to be ephedrine.
I know.
So I'm old enough to remember when they would sell it as the triple stack with ephedrine.
Yeah.
But some people dropped dead and they took it off the market.
Yep. Hey, it came back on the market in New Zealand last week.
Did it really?
Yeah.
It gets you going.
Yes, it does.
It's speedy.
Yeah.
It's dangerous.
Yeah. But the track stack, which has beta alanine and not ephedrine, is really good at encouraging an extra top end effect because you're having the caffeine, you're having a little bit of the blood thin from the aspirin, and then the vasodilatory properties and the carnosine aspect for muscle contraction from the beta alanine. And so, like training for gravel races in the top end sprint, you do a couple of sprint sessions with that, and it's increasing your training stress during the training. So your adaptation is to that higher stress.
Should anything be done in terms of recovery to make sure that you offset that additional stress that's achieved with this track stack?
Yeah. Just making sure that you're not stacking 2 days in a row of high intensity work, like really making sure that you're recovering well because it is a significant stress on the body.
What about sleep? We hear so much these days about the importance of sleep for mental health, physical health, performance. I think this is a great thing, a great trend. Are there female-specific requirements for sleep that vary across the menstrual cycle and or by age, or just generally, do men and women need to think about the need for sleep differently?
Yeah. Part of it is the obvious, like when you're talking about sleep temperature, right? Women and men have variations in their sleep temperature and what's optimal. So looking at that, like you need to create an environment for you that is cool, comfortable, which is probably going to be different from your partner who might be sharing your bed. So that becomes a sticky point. When we talk about the menstrual cycle, there are definitive changes in sleep architecture. We're seeing that in around the mid-luteal to the premenstrual, so that about 10 days before your period starts, significant change in your slow wave sleep. There's less of it. Latency is increased, so you have a longer time to get to sleep and you have more light sleep. So overall, less of that deep recovery sleep. And this is where women tend to have more of their mood issues too, because of estrogens play with serotonin in the brain. So we really need to nail down our sleep hygiene in that time period. So looking at things like L-theanine and apigenin and looking at your room temperature and the screens and all the things that you've talked about for the most part about sleep and sleep hygiene, super important. And then, of course, as you get older, in both men and women, it becomes more difficult to sleep. But we see a significant issue with insomnia in women who have really bad hot flushes and significant menopausal symptoms. And again, this has to do with lots of the perturbations from temperatures, of night sweats, increased sympathetic load, not being able to get into a parasympathetic state. So this is where working with a specific sleep specialist might come into play. We can also look at using some adaptogens, the rhodiola stacked with theanine, and looking at the cold temperature, getting people to use the non-sleep deep rest or yoga nidra or some other kind of meditative property that they can then access when they're in bed. So there's a lot of different things that we have to be aware of. And again, in that perimenopausal state, we see that significant change in sleep and sleep architecture and quality of the sleep, but men don't have the same thing. So women have to be a little bit more aligned with what's happening from a hormonal profile standpoint, because it does definitively affect serotonin, melatonin, and sleep architecture because of the interplay that estrogen has on the brain and the receptors.
That makes very good sense. We'll put a link in the show note captions to some zero-cost non-sleep deep rest yoga nidras. We've put out a couple with my voice. If you prefer another voice, I'm a big fan of the ones by Kelly Boys, who's contributed to the Waking Up app. It also has terrific non-sleep deep rest yoga nidras out there, and there are others as well. You mentioned a few supplements, theanine, apigenin, which is chamomile extract.
Yeah.
Maybe let's just have a general conversation about supplements. What's your thought on supplements? How do you place them into the landscape of nutrition? They are, after all, supplements, not replacements. But the word supplements, I believe, is a little bit misleading because there are food-based supplements, like a protein powder. There are supplements designed to achieve a specific outcome, and then there are supplements that are kind of designed to be a more, support for a bunch of things, kind of insurance policy. What are some of your favorite supplements in any of those categories, specifically for women, and perhaps even specifically during certain phases of the menstrual cycle and or perimenopause, menopause? I just threw about 9 questions
All
at
of
you.
Okay, the number one is creatine. Creatine for women, doesn't matter what age. It's really important. We're seeing a lot for brain mood and actually gut health.
So 5 grams of creatine monohydrate per day, sort of
3 to
typical?
5.
3 to 5?
Yep. Preferably, of course, Creapure because of the way it's produced. So if you're looking at Creapure, it's the German company that produces it. Uses a water-based wash to produce the creatine,
Interesting.
whereas others use an acid-based wash, and we see a lot of side effects with the acid-based wash.
Like gastric distress?
Yeah. So people are like, "Oh, I'm really bloated and I have nausea and stuff from taking creatine." I'm like, "Is it Creapure?" Actually, no. It's like switch to Creapure, and so they switch, and they're like, "Oh my gosh, I feel so much better."
Noted.
Yeah. And then vitamin D3, really important, especially when we're looking at all the information that's coming out from cardiovascular, muscle, brain, everything that goes with vitamin D. Also with iron. So vitamin D is really important for absorbing and maintaining iron stores. So those are the 2 big ones. And then
Sorry, I just want to stop you for a moment. As it relates to creatine, I hear 2 general lines of concern. One, I hear more often from women. My understanding is that because creatine brings water into the muscle, as well as supporting the phosphocreatine system of the brain, the water into the muscle component means, yes, people who take creatine 3 to 5 grams per day will gain a few pounds of body weight. That's solid body weight in the form of water within the muscle. So solid in air quotes. It's
Yeah.
water, but it's within the muscle. It's,
Yeah.
so they should know that.
it's not a given, though.
Interesting.
It's not a given. There are some women on the lower dose of 3 that don't experience the water gain.
Okay. And this is not bloat like water, subcutaneous water. This is water within the muscles.
Correct.
So it will be stored within lean tissue.
Correct.
And then I do hear concerns about creatine causing hair loss. My understanding is there is 0 evidence for that.
No evidence.
There is a smidgen of evidence that it might increase dihydrotestosterone levels, but it's like one study, marginal increase, and then people linked dihydrotestosterone to hair loss. And so then the conclusion people drew was that somehow creatine increases hair loss. But you're saying 0 evidence.
No evidence. We see that women who start taking it midlife are complaining about it, but it's actually a progestin-driven thing. We see progesterone and fluctuation. Progesterone can exacerbate any hair loss. So if women are experiencing that and they're saying, "Oh, it's creatine," I've read all this stuff on creatine. No, it's not.
Okay, so we've got creatine D3, 1,000 IUs per day, 5,000 IUs. I guess it depends a little bit.
Yeah. Being very close to Antarctica in the southern hemisphere in the winter, very low sunlight exposure, looking at around the 5,000. Same with upper northern hemisphere, UK, that kind of stuff. Closer you get to the equator, the less you need. The one concern is like a day here where it's foggy and it's supposed to be sunny, and people are like, "Great, I don't have to worry about going out in sun exposure." But then the next day it's bright and sunny, and they're like, "Ooh, sunscreen." So they put sunscreen on and not getting the right sun exposure. So then again, it is a lifestyle thing. So basic is 2 to 5,000.
Great. Okay, so we've got creatine, vitamin D3. What are some of the other supplements that you take, or that you, I don't know if we say suggest, but that you perhaps suggest women consider?
Yeah, so protein powder, really good high quality, because the amount of protein that women should be getting is often difficult to eat. So again, supplementing, not using it as the mainstay. That's one to consider. And then again, I'm about adaptogens. So looking at the different adaptogens, ashwagandha is a good one. Holy basil or tulsi is another one. Shishandra, and then getting into some of your medicinal mushrooms, lion's mane, reishi. Those are the 2 big ones that I look to and often have women use.
If these adaptogens blunt cortisol, because certain ones do, like ashwagandha, which, by the way, I do think people should cycle if they're going to take it high
Absolutely,
doses,
yeah.
right? Because there are some issues with liver
And thyroid.
and thyroid problems if people take ashwagandha at high doses for too long. So that's important to note. But assuming that the adaptogens are reducing cortisol levels, in addition to doing other things, is there a particular time of day or night that people should consider taking them? Should they avoid taking it early in the day? My understanding was that you want a bit of that cortisol bump early in the day, but you certainly want cortisol lower later in the day.
Yep. And I think the problem is people think that they don't want any cortisol. And they think
that would be bad.
That would be bad. They don't understand that the body has fluctuations of cortisol throughout the day, and that's normal. If we're looking at having issues with sleeping and that anxiety provoke from that sympathetic drive and elevation of cortisol, let it peak in the morning after you're waking up, and look late afternoon, like 4 o'clock when it starts to dip, to take your adaptogens then, because then it feeds forward to being able to relax more, which feeds forward to better sleep. For something like Shashandra, where you're looking for that brain focus, you can have it in the morning. It doesn't necessarily have as big an impact on cortisol that you see with something like Tulsi or Ashwagandha, because Shashandra is more stimulatory. The other two are more calming. I put some in my morning coffee, and then in the afternoon, when I need to pick me up instead of more caffeine, I'll use Shashandra, because it gives you that boost without the effects of caffeine, and it doesn't interfere with sleep. So there's a time and a place to take them. And yes, some need to be cycled on, some need to be cycled off. But I tell women, what are your main symptoms? What are the things you're looking to control? And we can look and see what kind of adaptogens we can use and how we place them.
What's the story with pregnancy and training?
Yeah.
Is there an official word on this? Assuming a woman knows that she's pregnant from the very beginning of missing a period where she's in a position to make decisions about training or not training at a given intensity or not. What are your recommendations?
The human body is really interesting. And when you get pregnant, your body tells you what you can do. So we see that you have a reduction in your anaerobic capacity on purpose. Your body's trying to be protective. You do have an expansion of your blood volume. So endurance is really good, but you can't do high intensity. When we're looking at the general guidelines that are out there, they've gotten rid of the heart rate rule. They are now telling women to be as active as they can be without creating injury and without trying to make gains. So that means if you're in the weight room, you're not looking to improve, you're looking to maintain. If you're doing cardiovascular work and you have a specific class that you love to go to, yeah, but don't beat yourself up that you can't hit that high intensity. You're going for the social aspect. You're not trying to gain fitness. You're trying to maintain. I think the very worst possible scenario is someone is super active and stops doing everything because they're afraid, because then they get deconditioned and then they end up in a worse state than someone who was sedentary, who's now encouraged to walk during exercise. It hasn't been well researched because you can't get ethics to study pregnant women very well. So we go on a lot on case studies and case study notes. And the bottom line of it all is you stay active and you can do resistance training, you can do all the cardiovascular work, and your body will tell you what you can and can't do.
I've been asked whether or not pregnant women can do deliberate cold exposure, probably no fewer than 2,500 times on social media, and I never have an answer. But I always default to the cautious answer, which is please don't until you talk to somebody who actually has an answer.
Yeah.
Just because it sounds like a very precarious situation, but in all honesty, I don't know. I'm just biding time there and just saying, please go ask somebody who can give you a definitive answer.
Yeah, so we see women who have a high risk for miscarriage, that anything that they do that's incredibly stressful for the first 12 to 20 weeks will put them at a higher risk for it. So being very cautious, especially with cold, because we know that there are so many different nuances. Doing something like hot yoga when you're pregnant is not, there is research, so it's not detrimental.
Really?
Yeah. Because when we're looking at blood flow diversion that way, when you have slight hypoxia to the placenta and to the baby, there is a rebound effect that increases the vascularization so that the baby has better nutrients. We see this also with like exercise and exercise intensities. This is why people are now saying you need to have some kind of blood flow change and increase in core temperature to create these vascular effects within the placenta to improve nutrient delivery to the developing fetus. So heat's good. Cold, I'm not so sure of.
But probably not extreme heat.
Not extreme heat. So that's what I mean. Like hot yoga is not going to the sauna. Hot yoga sits around 40 degrees Celsius. So what is that? Just around 100 degrees Fahrenheit. And in that situation, if you're feeling too hot, you leave, you lie down on the floor. Don't try to stay for the whole class. But it's not going to be detrimental unless you're pushing yourself too much. Again, everything in moderation, especially when you're pregnant.
It's almost the inverse of what we know for males, which is if men want to conceive, they should avoid the sauna because we know that heat is detrimental to sperm viability in a real way. So much so that I tell guys if they are trying to get their partner pregnant that they should bring an ice pack into the sauna. They should insulate that ice pack.
Yeah.
Don't put it directly on the scrotum for other reasons. But